I'm Dr Christopher McCormick. I'm an associate professor in the Faculty of Medicine at the University of Southampton. I have a research interest in virology and as well as that I'm responsible for teaching basic science to medical undergraduate students and medical graduate students. I first became aware of the COVID-19 outbreak back at the beginning of January when I was at a meeting with other colleagues preparing for a conference that we were to have in April. One of my colleagues said, "Do you think we should include within this meeting a section on the new coronavirus outbreak that's taking place in China?" And at the time we decided it probably wasn't appropriate to do so because it was a bit premature. I think that goes to show how quickly one can go from a small zoonotic event where a virus has jumped from another species into the human population to a point where we have a global pandemic causing hundreds of thousands of deaths and shutting down a lot of industry across the world. So Southampton has a containment level 3 suite, which houses 3 separate laboratories. Now, containment level 3 lab is one which has a much greater level of biocontainment than you would normally see in a typical microbiological lab. Because the containment level 3 labs were already in place, it was possible to relatively quickly turn their use round to COVID-19 research. Work started at about the middle of March, and we've now got to a point where we're able to handle virus, grow it in cell culture, and undertake assays that allow us to establish the concentration of the virus in our fluids, using a technique we refer to as Plaque assay. Because we can grow the virus in the lab and we can work out how much virus there's a variety of opportunities of regards to research that could be undertaken. Some of the researchers in Southampton are undertaking COVID-19 related projects where they're getting patient samples and they need to process them in a certain way. Now the processing technique they're using requires that those patient samples be treated not using the standard disinfection techniques, because then that will destroy the sample to a point where they can't use it. The samples need to be processed differently. So we're working with those researchers to identify means by which we can inactivate the sample, yet the sample is still useful for them in order to carry out their own research. We have a very strong respiratory group, which have a number of sophisticated cell culture-based models that allow us to study the virus interaction with host cells in a lot more detail and a lot more accurately than would be possible using just normal cell lines that we just typically use to grow the virus in. And so what we hope to do is challenge these cell culture model systems with the virus we're growing in the containment level 3 labs and see how they respond to viral infections. That will give us an idea of how we might go about treating patients in the future and sorts of drugs we can use. Working in the hospital itself within the Faculty of Medicine offers great benefits to doing the work we do, because we have much closer communication and contact with our clinical colleagues, and so that interaction between researchers and clinicians allow us to conceive research ideas that we perhaps wouldn't conceive on our own, and the access to clinical samples from the researcher's point of view is invaluable. At the same time, we're able to provide our clinical colleagues with advice and help that they couldn't otherwise have access to. As an example, someone from the NHS contacted me just yesterday asking whether I would help validate an inactivation procedure for them so they could carry out a more effective testing of patients in the hospital. An ounce of prevention is worth a pound of cure. I think we really need in the future, and we will hopefully in the future, invest in the infrastructure that will be necessary so that when the next pandemic comes along, we don't have the same situation as what we've had with COVID-19.